Vasculitis is a complex and often misunderstood group of diseases. It is characterized by inflammation of the blood vessels. This inflammation can cause the walls of the blood vessels to thicken. This thickening can restrict blood flow to organs and tissues. Imagine your blood vessels as a network of pipes delivering vital nutrients and oxygen throughout your body. Now picture these pipes becoming inflamed and narrowed, restricting the flow of essential supplies. This is what happens in vasculitis, affecting various organs depending on the specific vessels involved. Vasculitis can affect anyone, regardless of age, gender, or ethnicity. While it is relatively uncommon, it can have significant impacts on a person's health and well-being. Understanding the basics of vasculitis, including its types, symptoms, and treatment options, is crucial for early detection and management. The good news is that with proper diagnosis and treatment, many people with vasculitis can manage their condition effectively and lead full and active lives. This essay aims to shed light on this often invisible illness, empowering patients and their loved ones with knowledge and hope. Vasculitis is not a single disease but rather a family of disorders, each with unique characteristics. These different types are classified based on the size and location of the affected blood vessels. Some forms of vasculitis primarily affect small blood vessels such as those in the skin, kidneys, and joints. Examples include cutaneous vasculitis and Henoch-Schönlein purpura. Others target medium-sized vessels impacting organs like the lungs, heart, and digestive system, as seen in polyarteritis nodosa. Large vessel vasculitis involves arteries like the aorta and its branches. These types, including giant cell arteritis and Takayasu arteritis, can cause severe complications if left untreated. The diverse nature of vasculitis underscores the importance of accurate diagnosis to determine the specific type and guide treatment decisions. This variety in vasculitis types means that symptoms can vary greatly from person to person. Some might experience mild symptoms while others face more serious health challenges. Vasculitis can manifest in a myriad of ways, making it challenging to diagnose. Symptoms often develop gradually and can mimic other conditions, further complicating the process. However, understanding the common warning signs is crucial for early detection and intervention. General symptoms often resemble those of a common infection, including fever, fatigue, and weight loss. As the condition progresses, more specific symptoms may arise depending on the affected organs. For instance, involvement of the skin can lead to rashes, ulcers, or purplish spots. When vasculitis affects the nerves, it can cause numbness, tingling, or weakness in the extremities. Kidney involvement may manifest as high blood pressure, protein in the urine, or even kidney failure. If you experience any unusual or persistent symptoms, it is essential to consult a healthcare professional for proper evaluation. Remember, early diagnosis and treatment are crucial for improving outcomes and preventing long-term complications associated with vasculitis. Do not hesitate to seek medical attention if you have any concerns. While the exact causes of vasculitis remain largely unknown, researchers believe that a combination of factors contributes to its development. One prevailing theory points to an autoimmune response, where the body's immune system mistakenly attacks its own blood vessels. Certain infections, such as hepatitis B and C, have been linked to an increased risk of vasculitis. Exposure to environmental toxins like certain medications and chemicals is also thought to play a role. Additionally, genetics may predispose individuals to developing the condition. Risk factors for vasculitis vary depending on the specific type. For example, giant cell arteritis primarily affects older adults, while Kawasaki disease is more common in young children. Smoking is a significant risk factor for some types of vasculitis, highlighting the importance of lifestyle modifications in reducing risk. Despite ongoing research, there is currently no definitive way to prevent vasculitis. However, understanding the potential causes and risk factors can help individuals make informed decisions about their health and seek medical attention promptly if they experience any concerning symptoms. Section 5. The diagnostic journey identifying vasculitis. Diagnosing vasculitis can be a complex and challenging process due to its varied symptoms and the need to rule out other conditions. It often requires a multidisciplinary approach involving specialists from various fields, such as rheumatology, immunology, and vascular medicine. The diagnostic journey typically begins with a thorough medical history and physical examination. Your doctor will inquire about your symptoms, their duration, and any relevant medical history or family history of autoimmune diseases. Blood tests are essential to look for markers of inflammation such as elevated erythrocyte sedimentation rate or ESR and C-reactive protein, also known as CRP. Imaging studies such as ultrasounds, kinetic scans, and MRIs can help visualize the affected blood vessels and assess the extent of the inflammation. In some cases, a biopsy of the affected tissue may be necessary to confirm the diagnosis. This involves taking a small sample of the tissue and examining it under a microscope for signs of vasculitis. The diagnostic process may take time and involve multiple tests and consultations with specialists. It is important to be patient and work closely with your healthcare team to ensure an accurate diagnosis and develop an appropriate treatment plan tailored to your specific needs. Section 6. Navigating treatment, options and outcomes. Treatment for vasculitis aims to control inflammation, suppress the immune system's overactivity, and prevent further damage to blood vessels. The specific approach depends on the type and severity of vasculitis, the affected organs, and the individual's overall health. Corticosteroids, such as prednisone, are often the first line of treatment. These powerful anti-inflammatory drugs work by reducing inflammation in the blood vessels. In severe cases, immunosuppressive medications like cyclophosphamide and rituximab may be necessary to further suppress the immune system's attack on blood vessels. Alongside medications, lifestyle modifications play a crucial role in managing vasculitis. Quitting smoking is essential, as smoking can worsen the condition and increase the risk of complications. Eating a healthy diet, exercising regularly, and getting enough sleep can also help manage symptoms and improve overall well-being. Treatment for vasculitis is often long-term and requires close monitoring by healthcare professionals. Regular checkups, blood tests, and imaging studies help assess treatment effectiveness, monitor for potential side effects, and make necessary adjustments to the treatment plan. Section 7. Living with vasculitis, management and support. Living with a chronic condition like vasculitis can be challenging, but it is possible to live a full and meaningful life with the right management strategies and support system. It is crucial to take an active role in your healthcare by following your doctor's recommendations, taking medications as prescribed, and attending all scheduled appointments. Educate yourself about your specific type of vasculitis, its potential complications, and the importance of early recognition and management of flares. Connecting with others who understand your journey can provide invaluable support and encouragement. Support groups, both online and in person, offer a safe space to share experiences, exchange coping mechanisms, and learn from others facing similar challenges. Don't be afraid to ask for help from loved ones when you need it. Whether it's assistance with daily tasks, emotional support, or simply someone to talk to, having a strong support system can make a world of difference in managing the emotional and practical aspects of living with vasculitis. Remember, you are not alone in this journey. With the right knowledge, resources, and support, you can navigate the challenges of vasculitis and live a fulfilling life. At Section 8, Research and Advancements, a Beacon of Hope. The field of vasculitis research is constantly evolving, offering new hope for improved diagnosis, treatment, and ultimately, a cure. Scientists are working tirelessly to understand the underlying causes of vasculitis, identify new drug targets, and develop more effective and targeted therapies with fewer side effects. Clinical trials are underway to evaluate the safety and efficacy of promising new medications and treatment approaches. These trials provide hope for individuals with vasculitis who have not responded well to conventional therapies or who experience significant side effects from existing medications. Advancements in imaging technology are also enhancing our ability to diagnose and monitor vasculitis. High-resolution imaging techniques allow doctors to visualize blood vessels in greater detail, detect early signs of inflammation, and assess treatment response more accurately. The future of vasculitis research is promising, and these ongoing advancements offer hope for improved outcomes and a brighter future for individuals living with this challenging condition. Section 9. Conclusion: Empowering patients through knowledge. Vasculitis, although a complex and often challenging group of diseases, should not define a person's life. By understanding the basics of vasculitis, its types, symptoms, causes, and treatment options, Individuals can take an active role in managing their health and advocating for their well-being. Early diagnosis and treatment are crucial for improving outcomes and preventing long-term complications. If you experience any unusual or persistent symptoms, do not hesitate to seek medical attention. Remember, you are your own best advocate, and your voice matters in your healthcare journey. With increased awareness, ongoing research, and advancements in treatment, there is hope for a brighter future for individuals with vasculitis. By working together, patients, families, healthcare providers, and researchers, we can strive towards a world where vasculitis is no longer an invisible illness, but a manageable condition that does not define a person's life.